Welcome to Restorative Practices in Schools. As you will notice, all participants have been muted. If you have any technical issues, please use the chat icon for further assistance. I will now turn the call over to Vera Foyer for today's presentation. Vera?
Welcome, everybody, and thank you so much for joining us for this workshop today. I am here with my fantastic colleague from the Valley Stream Central High School District, Keisha Smith-Farnham, and we are here to talk about restorative practices in schools today. My name is Vera Foyer. I'm a child and adolescent psychiatrist, and I work with schools and really talk a lot about different ways that schools can help students. And I wanted to focus on this topic because I think it is one that is really, really important. I think that today we're going to hopefully give you guys some tools and some very simple to implement tools that really make a huge difference in kids' lives. So to get us going, I am going to start with a little bit of an introduction to what restorative practices are. We'll talk a little bit about what are some key components, and then how does this all relate to mental health and mental health in schools, and what are some benefits of these practices that we get for students overall, and a specific focus on mental health. And then we will hear a little bit about how this all comes alive in a school. And we'll talk about Valley Stream Central High School District and some of the work that's being done there with the students. So to get us going, it's always really, really important to go with definitions. And if you will, be so kind and humor me in this little exercise. I love word clouds. I think it's a great way to engage large groups of people. We do have over 600 people on this webinar right now. So if you can scan that QR code or join us on that text message or web address above, if you're able to, we will soon hopefully see what comes to mind when you think of restorative practices, and what are some things or thoughts that you have. I hope this works. Double check it myself. If it doesn't work, we'll just move on. It seems like responses are not coming in. Maybe you can skip registration if that comes up when you first fill it up. Okay. Put link in the chat. Try to do that. Okay. All right. It doesn't seem to be working, and I don't want to waste too much time. You can certainly put it in the chat, and some are coming in. Repair, self-care, reflective practice that helps students make amends. Thank you for chatting them in, or putting it in a Q&A. An approach to restore and address conflicts, community accountability, mediation, healing, mediation versus punishment, school to prison pipeline, alternative discipline, attention, healing, relationships, alternatives to discipline, repair harm, improve relationships, conflict resolution. I'm so sad this word cloud didn't work. It would be a beautiful one. Maybe we'll recreate it from the chat. Community building, creating community, to teach people that they have value, although they made mistakes, to tell people that mistakes don't define them. All really, really wonderful. Proactive versus reactive, creating healthy relationships. It worked. There you go. It all came in at the end. And here's your word cloud that you created. So thank you for that. Circles, communication, harm, community, relationships are coming on as the biggest words here. And that really, I think, defines and well describes what we're going to talk about today. But I do want to make a distinction first between the term restorative justice and restorative practices, because they are a little bit different. So Restorative justice is really an approach to justice that focuses on the needs of the victims, the offenders, and the involved community. So really what's important to understand about this approach, that it addresses harm that is caused by the conflict, that it really focuses, like you guys shared in the word cloud, healing for both the victims and the perpetrators, encourages accountability and responsibility of the offender. So really helping to for the offender also to help take accountability and responsibility, and then aims to reintegrate the offender into the community. Restorative justice tends to be reactive, and it tends to be used after harm has already occurred. And the focus really is on resolving that specific conflict or the harm caused by that conflict. The history of this and of restorative practices in general is that it does have its origins in practices of indigenous communities, and really emphasizes that connection in that community and healing circles as something that's coming from us from these indigenous communities. And in the 1970s, it started emerging as an approach in the justice system in the United States and Canada. And then in the 80s and 90s, it sort of reached globalization and spread to other countries. And it introduced concepts like victim offender mediation programs and community justice panels. And in schools, this has been applied since the 2000 as an approach during conflict resolution, disciplinary actions, and after incidents, again, as a reactive approach after some harm has occurred. But instead of dealing with it with punishment, to address these disciplinary issues by improving student relationships and in general promoting the school positive culture. So in the, the differences, to just talk a little bit about the contrast between restorative justice and restorative practices are really do encompass more of all the methods and strategies that are used to build a community and manage conflict, and really promoting communication, empathy, and understanding. It tends to be proactive to prevent these issues from coming by building a community, by building these skills in kids and students, and creating these entities that we're going to talk about later that help prevent some of the issues. But then it also can be reactive as well. So it's both proactive and reactive, because it also reacts to resolve conflicts when they do occur, and focuses again on building relationships, social connections. And the broader application is really about creating positive school climate and preventing conflict. If you joined our first panel today focused a lot on loneliness. And we talked a little bit about what are things, why is loneliness something so important to address, and what is the role of schools? So I do want to just tie back to that for a moment, because the value of restorative practices, there's many, many values, but one of the really important values overall as a global impact on students and our staff and the school community is enhancing that school climate and creating a climate that does enhance connectedness and a general feeling of belonging. And we've talked about it in the past hour, how that is so important and really helps prevent so many issues that our kids and our staff can be subjected to. So similar to restorative justice, restorative practices also started developing more in the 70s, 80s. And then the Institute of Restorative Practices was formed in the 90s, which really was a crucial role in defining and promoting these practices globally. And then again, bringing it to the schools in the 2000s in the United States, Canada, and Australia. And by the mid 2000s, adopted in worldwide, influenced by all the positive outcomes that were coming out. And we're going to talk about this in more detail, but really a lot of research that supports that there is a reduction in suspensions, expulsions, disciplinary actions, absenteeism, and of course, an improved school climate. And we know that the impact of that does have an individual impact on the mental health of students. So to introduce core principles, and it's so exciting to see that in the word cloud, I think all of these things have come up. Community building as a core principle is really at the foundation of restorative practices, because really the idea is to foster relationships, foster communication, foster connections among individuals, because that serves the basis of us being able to resolve conflict. If you think about it, in a stable relationship, in a relationship that's strong, that is built on trust, that where you feel that you belong and you trust the other person, resolving conflict and having issues communicated is going to go much better. So that community building, really important. Inclusivity is another really important concept. You know, you guys in schools have obviously all kinds of kids with all kinds of issues and backgrounds, and ensuring that all voices are heard and valued during discussions, that there's not a student or a group of students that feels like they are being marginalized, that their voices are not being heard. Really important, in particular, because as we'll talk about, sometimes it's the most vulnerable students who already come to us struggling with so much from their community, their families, their backgrounds, and carrying so many problems that can be vulnerable to being marginalized to begin with. And so really making sure that we're including everybody's voice and valuing it really becomes very important. Accountability, encouraging individuals to take responsibility for their actions, to understand the impact of those actions and how they can repair. And of course, healing, focusing on the emotional and psychological recovery of, again, not just the victim, but of all participants in our practices. And these are the different tiers of sort of the interventions. The tiers, we're all familiar with tiered systems. Tier 1 is preventive services, so building relationships. And we're going to talk in more detail about community circles and classes and advisories, conflict resolution, pairing spaces in our schools where kids can go calm, resources like counseling or support. Those are all at that base of building relationships. And then as we move to the higher levels, conflict mediation, repair conversations, healing or problem solving circles, support for making amends when something happened, the conflict happened, responding to those challenges. And then at the highest level, at tier 3, when we have had issues with people that maybe need to re-enter our community, having that support for them, re-entry circles, interventions, restorative counseling to help continue support their healing becomes in that focus of that last level. And these tools and components are what are used in restorative practices. Restorative conversations are open, honest dialogues that really help kids understand different perspectives and feelings. They're facilitated by staff and really help in, again, reviewing different viewpoints and perspectives and helping students understand the impact, again, focusing on that accountability and inclusivity of including everybody's viewpoint and really understanding how one thing can be perceived so differently and how can we each participate in understanding each other. Circles are structured group discussions. They can be used for many purposes. Really, it's the core tool in restorative practices is the restorative circle. So these are structured group discussions. They can be used for teaching, for conflict resolution, community enhancement, connection, really many different ways that they're being utilized in practice. And then conferences, or when a conflict did occur and we have something, again, at that higher level, when we're at the reactive space, and having formal meetings that involve victims, offenders, sometimes community members, where we're trying to understand, discuss the harm and begin to understand how we might go about repairing it. And fair process, again, going back to the inclusivity, ensuring engagement, explanation, and clarity in all interactions. Some additional tools that are used. So agreements and guidelines are often used to establish norms as we get going, as we get started with a circle or a group or building this community. Always really important to have a mutual understanding of our goal, of our rules, what are our norms, what are our guidelines, really setting the stage for everything else that follows after that has to be a core component. And sometimes that needs to be reviewed at the beginning of each session, and people need to be reminded about the rules and our agreements. And really, again, they're all about supporting each other. Like in many other sort of therapeutic interactions or communication, where we want to really understand more about different people's viewpoints, especially with kids and teens, really, really important to ask open-ended questions, to not give an opportunity to the yes, no, and the shrug, to really be able to ask questions in a way that are reflective, that deepen understanding, and then react to the content or the answer with more reflective questioning to clarify, to make sure that we understood what you said, to make sure that we have a good mutual understanding, and that we, as our conversation goes forward, deepen that understanding. Creating action plans is also really important, because when we have conflict, to be able to step out, highlight and describe the concrete steps that are taken for restitution, and to also help future conflict prevention. We already reviewed active listening, again, to fully concentrate, understand, respond, remember what's being said, all part of that open questioning and reflecting listening. And empathy and understanding, that sharing the feelings from another from their frame of reference. And it is really, really important to understand that we don't have to agree with what is said, we don't have to agree with what is done, but we can always understand or aim to understand and validate the feelings that people have, because those are their feelings, they're valid. And the more we understand about it or why they felt a certain way, the better we're going to be able to help them communicate that, and the better we're able to navigate these conflicts. And impartiality, facilitating discussions without personal bias or judgment. And as many of us are working with kids in a therapeutic capacity, many of us in this room today, really such an important component of what we do is really leaving ourselves outside the room to the extent possible. And of course, it's not possible completely, but being aware of our own biases, recognizing them, acknowledging them, and then with that knowledge and recognition, trying to be impartial to the people in front of us. Facilitation skills, of course, are core component that staff needs to help with navigating these conversations, managing group dynamics, and having constructive conversations, redirecting people gently without invalidating them. Those are all skills that are crucial in facilitating what can be a very sensitive discussion. So before I give it over to hear more about what first I'm going to talk a little bit about the impact of mental health, and then we'll hear about what is in practice. But I don't know if this is going to work again or not, if you've clicked on it. If not, just use the chat in the Q&A like before. But what's an example of a practice that you have used before? There we go, it's working. Restorative, circles, mediation. I'm going to read off the chat. Structured mediation people have used, addressing conflicts, reflection room in lieu of detention. Somebody's typing in. Circles people are using. Really great. Mediation, calming spaces, restorative circles. Those are some of the things that are coming through. Connection, peer mediation, statements, contracts. Circles is growing big. Seems like that's something people are using as a tool. Great. Fantastic. So glad to see that there are some practices that are being utilized. And so I'm not actually going to go into great detail because I want you guys to hear some practical applications. So I'm going to go through this very quickly. This will be available on the recording. But of course, mental health issues are big I don't have to review this with all of you. Lots of kids with anxious. And I just want to show this about how numbers in the United States are significantly higher than globally, which is something I think is important for us to recognize and realize that there is both hopefully better recognition and screening and addressing these issues, which is leading to the disparity of these numbers. But it's also important to recognize that culturally we are different and we have something going on here that is increasing these numbers more so than in the rest of the world. And I did want to mention the VIRBS, which is a study about the impact of youth mental health. And I'm just going to highlight one thing and then we'll switch over. But really want to highlight that in the 2023 Youth Risk Survey, which is a survey done every 2 years for decades now, the first early signs from 21 to 23 are there that adolescent mental health is maybe getting better. And I want to highlight that because we hear so much about everything getting worse and being so grim. But I do think that in the recent years, all the investment in schools and all the investment in the community that we're putting into improving children's mental health, I want to believe and I'm hopeful that this is a beginning of a trend that we are starting to see some decrease in the numbers. And to show you the 2-year change for the first time again in over a decade, this is not all red like it usually is, which shows worsening numbers. It's yellow or green, meaning numbers are getting slightly better or at least not significantly worse, both in terms of persistent feelings of helplessness, poor mental health, suicidality, and all of these factors. And the other thing I want to highlight is school connectedness, because it relates so significantly to what we're talking about here today, because that connectedness and what these restorative practices can help promote this connectedness is hugely protective for all of our children, for all kinds of risk factors. And so the benefits of restorative practices of mental health, I'm going to start in the bottom with promoting a more supportive school climate and enhancing connectedness, which is a significant indicator of being protective for school violence, for school mental health issues, for feeling safe at school. All of those metrics improve when we have a more supportive school climate. And these practices can be really crucial in building healthier relationships among students and staff, increasing connectedness, and as a result, reducing stress and anxiety. And of course, when people feel better, they behave better. So then we have these studies and research showing that these practices then in fact will have a positive impact on absenteeism and disciplinary incidents. So with that, I am going to turn it over to my fantastic colleague, and we'll hear a little bit about implementation in Valley Stream.
Hi, everyone. Pleasure joining in. And thank you so much, Vera. Very, very informative introduction. And everything you said was spot on. So everything you mentioned about what our students are experiencing and how the need is really great in the building. You definitely hit all the key points in that overview. So thank you again. So I'm just going to share a little bit of what we're doing in Valley Stream and what we're doing in the high school district. We really are focusing on the community building aspect. So when I looked at your responses, a lot of you said circles. Yeah, I think our emphasis this past 2 years we started has been on restorative circles to build community. We have a very strong motto here where it's have the circles before you need a circle, right? So we want to use the preventative aspect of restorative practices to really teach our students how to build community with each other. We believe very strongly that if you build that community and students get to know each other, they're less likely to want to harm each other. So that is the emphasis of the need for community building, and it should happen building wide. We talk about school climate. If we're doing it in the classrooms, we need to be doing it everywhere in the school, not just in isolated situations. So we want a larger impact to really push the school climate in a very positive direction. And sometimes it might be a few teachers doing it, but we can have a greater impact if the whole building has really adopted these practices. And that's our focus there. I truly believe that all learning is social and emotional. I started as a math teacher. So I've been a math teacher for 20 years in the Valley Stream Central High School District. And I took on this role as Director of Restorative Practices because I saw the great need. When I taught math in high school, I always say I was teaching from a very passionate lens. My students probably hated math, most of them that I encountered, but the way I taught it, I was teaching from an emotional, right, lens. I was teaching about something I love, and that love translated into the classroom. So I know sometimes as academics, we feel like SEL is not for us. We'll leave it to PPS, we'll leave it to the school psychologist or the social worker. But I think as teachers now, we have to realize that social and emotional learning is a part of the academic. And that emphasis is super important because it's been separated for too many years. And we know that there's a great need for social and emotional, our students' social and emotional wellness to be addressed. So this is exactly what the premise comes from. You know, when we encounter a student who can't read, what do? We teach them how to read. When we encounter a student who struggles in math, we know how to teach them math. We know how to get them to pass those Regis exams and get their high school diploma. But when we encounter a student who doesn't behave well, we punish them. And this is where restorative practice comes in. It's why can't we address the social and emotional need of a student the same way we address the academic need of a student? And with this blend of social, emotional, and academic, and using restorative practice, we can reach our students who are struggling social and emotionally, just as much as students who are struggling in math or reading. And as Vera said, there's a great need for a sense of belonging. And we did some research, and I like to focus on this because 64% of adults feel like they don't belong in their workplace. And it didn't start in adulthood, right? So if you didn't feel like you belong, it didn't just start when you graduated from college. It's something that was happening all throughout school. So how do we address that need for students to feel like they belong? So as an adult, you also have a greater sense of belonging. So we are focusing on reducing that sense of belonging. So students feel that way, and as adults, they'll feel like they belong. So on the next slide, Vera, we'll get to is the data that helped us. This is through Panorama. And this kind of shows us how important using circle practice to build community can really change the students' sense of belonging. So if you look at this data, each color represents how often the school used circles. So for the green, and I circled the sense of belonging, for the green bar, you'll notice that 49% of the students had an increased sense of belonging because they were doing circles either on a weekly or daily basis. So research is telling us that if we can include restorative practice on a weekly or daily basis, we will see huge improvements in students' sense of belonging. And we know that a sense of belonging can increase motivation, their physical health. It'll be reductions in behavioral incidents, better peer relationships, enhanced self-esteem. Social connections will be even stronger and more positive, emotional health, and academic performance. So these are the few of the things we're noticing that will be enhanced if we can increase our students' sense of belonging in our classrooms. So in our school district, what we did, this is kind of like a layout of how we started our year one, which was last year. And we still are working on this, which is tier 1 community building. That was our first goal. And then we also included academic circles. When we go into a math classroom or a language classroom or a science classroom, and we do an academic circle, and teachers are really, really loving that. Tier 2 and tier 3 circles address harm, which Vera spoke about. They're more like conferencing. We've done PTSA community building circles. We've worked with families, and the parents love it. And at the end of every PTSA community building circle, we only heard responses from parents saying, how often can my student experience this? Because they experience it and they see the benefits of it. So we've been doing a rotation of 3-day training for all of our staff members. We've done 9th grade push-in classrooms. We pushed into the entire 9th grade in Memorial Junior High School. We're planning to push into the entire 7th grade in North High School. We did the entire 8th grade in South High School. So we've been trying to tackle grades and kind of giving everyone an experience of community building. Jonna Brodman, I know she's here today, but she's not gonna be able to talk to us, but she's been doing restorative circles in her wellness center at North High School. And I'll show you a few slides later of what that script looks like. We've learned as a team, there's 8 of us, 8 counselors that got hired in our district to lead this mission. And I am the director of the program. And we've learned over the years that we've been working together now how to create our own scripts. And I'll show you an example of what a script looks like. So this is a sample of a Memorial Junior High School Social Studies 8th grade script. Vera mentioned we start every circle with a circle agreement. So these are the agreements we have the students review with us. We have them agree to it. You can modify that. It doesn't have to stay the same. You know, each community is different. And maybe a student wants to add to the circle agreement as well. We give them that freedom to join, to help us create those agreements. So this was a scenario, and we wanted to really have students know that their voice matters, right? And that their voice is going to matter as we get into like today, our voting day. We wanted students to know that even though they're too young to vote now, but it's going to be a part of their role as, you know, engaged citizens to have an opportunity to share that voice. So we did an exercise with them, and it was really fun for the kids. I was in one of these circles, and we wanted them to come up with different ways for them to survive together. Like, how would you survive together if you were stranded? And they were so creative. But the goal of this circle was to have students really listening to each other and thinking about how they can work together, even if they disagree, right? But how we can work together in a cohesive and positive way. And we've tied it to the election, and we tied it to the fact that we know that there are very opposing sides, but how can we find a common way to work together for the greater good, which is, you know, for our country. So it was really, really informative for our social studies class, and the teacher joined in and the students joined in. But this is an example of what a script would look like. And then during the Q&A, I'm more than willing to answer any questions about that. This is a college level Spanish class at Central High School. The two counselors there are Caitlin and Gina, and they're probably on the call also. And okay, no, we're finishing up here. And they did a topic on traditions. Same thing, they go over the agreements, and then they go into the rounds. If you've ever done one of these circles, you'll see that a simple round, like if you have a magic ticket to go anywhere, where are you going and who are you bringing? It brings so much information into the room and so much community building, because when students start talking about where they want to go, who they're going to bring, or they bring in an object that represents them, or food item to talk about their family and their tradition. After these rounds and these circles, teachers feel like I've sat with my student for weeks or for months and never knew this information about them before. So the connection is just not from student to student, it's from student to teacher, from teacher to student. Like the community is just really, really enhanced by doing one of these circles. And this is a North Wellness Circle picture. Just showing you a few pictures that we have there. And this is a wellness script that Jana created. And yep, this is South Falcon Nest. This is just some images of things that our district has been doing and still doing to create a more safe, welcoming, affirming environment and a greater sense of belonging. This is an example of the classroom that I just spoke about, the world language classroom, and the students brought in items that represented them. So on the cloth, the centerpiece cloth, those are all the items students brought in from their culture or anything that they felt would represent them in that circle. And it was just, they had a really, really good time. And this just goes into our tiered structure and our flow chart of prevention and when we go into intervention. So it's just a little bit more of the foundational things that we do. And a little bit more about, and Vera asked me to talk about like something that happened, or when does tier 2 or tier 3 kick in for restorative intervention. And this was a sample of a vandalism that took place. And the restorative approach was, instead of just suspending, how about finding a way to have the student learn from this situation in a restorative way. So we held a restorative circle or conference with parents and the students. And at the end of that circle, the outcome was the student, we found out that the vandalism was a cause, or as I would say, an effect of them feeling like they didn't belong. And at the end of the circle, we realized that there was an organization in our building that we introduced the student to, and they became a member of the organization. And it has really turned around the students' overall experience of being in school, because they felt a greater sense of connection and they felt like they belonged to a community, and they took accountability for what they did wrong and really made changes in their future. So I firsthand saw the positive effect of it. So in 2018, sometimes we don't realize that the state did issue recommendations for restorative practice and social emotional learning, and this happened in 2018. And this is a quote that I really use every time I do a presentation, because I feel like it sums up the need, and it's coming directly from the state. So you could just read that, and they emphasize the need for addressing behavior through a social emotional lens and using restorative practice as a base. So I really, really took away that quote. These are some of the resources we use in our district. Circle Forward, if you've never seen it before, and probably some of you use it, it is a resource to get scripts. If you are thinking about a topic that you want to do in your classrooms or with your parents, or a re-entry circle, or whatever it may be, Circle Forward is a great resource for all of those topics, self-esteem, or whatever it is. There's so many scripts in that book. Restorative Justice for Colleges and Universities is how we started. I met David Karp, the author of that book, and I work with one of his partners now, as practitioner who I've trained with, Duke Fisher. And restorative discipline is a great way to start if you're thinking about starting in your own school. We've done book studies with restorative discipline to talk about how to embed it in our buildings. And I think the last picture is my team. So it's our 8 counselors, and we have Duke Fisher over there in the picture on the right with 2 of the teachers from our buildings who have just been in the training. And I think that's it for me.
Fantastic. Thank you so much. There are some really practical questions here in the Q&A about one. I think you did talk in the sample scripts a little bit about how do you connect this to the classroom curriculum and how do you bring it back to the teaching and the subject. But there's also a question about how do you arrange the day on a daily basis? Do you add time to the day, such as a 0 or 9th period, to be able to carve out time to be able to do this work? Can you talk to us a little bit about that?
So we don't, but I guess some schools are a little bit different. In one of our buildings, there is an advisory period built in, so they can do the restorative practices there without interrupting the day-to-day. The ideal situation would be to have an advisory for every school, so it's built in, but it has not happened yet. And if your school is able to have an advisory, that would be the best place to start. Definitely. So right now, it's on an invitation basis. So teachers reach out to our counselors. There's 2 counselors in each building, restorative counselors. And if a teacher feels that there's a need for community building, maybe the groups of students are not working well together. Maybe, when teachers want them to work as a partner or work in groups, they just don't talk. They just sit there and really stare at each other. We'll come in and we'll gather the students and really get them into the community building as an invitation from the teacher. And we've done that. So teachers have invited us in and we plan with them what the goals are. And we actually create the script with them and model it.
Great.
Mm-hmm.
Great suggestions. There's also a question about trainings. You mentioned that your team took a 3-day training and got a lot of information. Any suggestions for folks that are interested in more training?
Oh, absolutely. I have a ton of resources I can share with you. We're working with Adele Bovard right now. She is a former superintendent on Long Island, and she's a former principal. She worked through the entire chain of education, and she's definitely a valuable resource. We've worked with the Institute, IIRP, International Institute of Restorative Practices. We were trained with them. We're trained with RJ Ed, so it's another resource, and I can share those resources with you. Duke Fisher is another resource, but we've had facilitators, practitioners actually come in and train our staff and train our counselors.
Fantastic. Great, thank you. There's also some comments that I was really appreciating, and I really echo that the highlight that this is not just the clinical staff members in the school that should be involved with these initiatives, and how important it is for teachers, administrators, and really to have that whole school approach.
Absolutely. Yeah. I think that was yes, we did a lot of surveys with our students, and that was one of the feedback. They wanted mental health not to be stigmatized and kind of treated with this sense of it's like you can only get help from your counselor. You have to go and have a private appointment or session. They wanted teachers to make it just kind of like a regular thing to do, like Absolutely. A part of their day-to-day, not just something I have to go seek help for, but they wanted teachers to make it more inviting and make it more open, where they felt comfortable even in the classroom or even in a conversation with a teacher, to share something. Yeah, so that was definitely something we got from kids.
Yeah, and I think it's so right on. It's spot on, right? Because the whole idea about these practices and what they promote and why they work and how they work is about community. And you cannot create community without every participant in
That's
that
right.
community really understanding and participating and helping promote it and destigmatizing mental health. And really, I love your slide about, when somebody doesn't know math, we teach them. When somebody doesn't know how to read, we teach them how to read. The focus on behaviors and emotion regulation as sort of tools that kids have to communicate something that is going on with them, I think is so, so important. And I guess that's my parting thought as we finish and wrap up with our time here, is that approach of understanding every behavior, every issue with emotion regulation that our students are struggling with as their ways, that's the way they can communicate. And they need our help to learn more constructive ways of communicating. But for that, we need to listen. And we need to really be able to be there and be present and hear them and hear their viewpoints. Any parting thoughts from you as we wrap up?
No, thank you so much. Thank you for what you do every day with our kids, for our kids. Thank you for just being an active listener in their lives, because that's all they need sometimes, just for us to listen.
Yeah, absolutely. Thank you so much, everyone. Our time is up. The next session begins at 11:30, and now between 11 and 11:30, please go to the Explo 4. There's going to be a lot of resources shared. Many of you asked questions about resources for care. So all our teams are going to be there sharing all the resources within Northwell. Please visit and continue the conversations. And thank you so much for coming.
Thank you.
Have a good rest of the day. Thank you so much.
Vera, did you want us to share? Did you want me to share any of the resources here in this chat?
I think people are leaving now. We're gonna find, if you can share with me, we're gonna find a way to post it.
Okay, so I'll share with you.
Yes. Thank you so much.
Thank you.
Good job. Thank you. Bye-bye.
Bye-bye.
Thank you, everyone, for joining us. Our next seminar will begin at 11:30. To find out more about our upcoming sessions, please visit the event lobby for discussion topics and event speaker details. Coming up next, please join us on the expo floor from 11 to 11:30 to meet with different Northwell Health departments. You can find these books by selecting the Expo tab on the top right of the lobby. Thank you again, everyone, and have a great day.
Yes, please. Congratulations.